is it your position that even if Michael Jackson self-medicated with excessive amounts of lorazepam and bolus pushed 25 milligrams of propofol, that Dr. Murray is still responsible for his death?
Absolutely.
Would you think a doctor that prescribed a patient 30 Ambien and the patient took them all and killed himself, that the doctor would be responsible?
Objection is irrelevant. Hypothetical.
Nothing further at this time, Your Honor.
Mr. Flanagan, thank you. Redirect examination by the people. Mr. Walgren.
Thank you, Your Honor.
You're welcome.
Dr. Kamangar, I want to follow up on Mr. Flanagan's hypothetical in which Mr. Flanagan fell to the floor and had some type of arrest right here, okay? Now, as a qualified medical doctor, if Mr. Flanagan fell to this floor, you would not wait 12 minutes and then call Mr. Flanagan's legal secretary and then tell that legal secretary to send a law clerk upstairs to assist with Mr. Flanagan, who's dying on the floor, would you?
I don't think that's a proper hypothetical, Your
Is there
Honor.
an objection?
Yes.
Sustained. You may rephrase.
Would you wait 12 minutes to call? Let me just ask you. You would call 911 immediately because you would know you were lacking the emergency equipment and everything that was necessary to save the individual's life, correct?
That's absolutely correct.
And that not only is that a moral and professional obligation, it's basic common sense, isn't it?
That's absolutely right. I mean, that is putting your patient first.
Now, you had been asked about dehydration. I think you wanted to elaborate on something regarding Dr. Murray saying that he had given saline for dehydration. What was it that you wished to elaborate
Right.
on?
What I was trying to say was that I did read that in the transcript, but
The objection is overruled. Please.
that he mentioned that as being a problem when he was interviewed by the staff at UCLA Medical Center that asked about what was going on with him. So I think there was that persistent concern even at that point.
Okay, thank you. And regarding Dr. Klein's medical records, those were provided to you by me, correct? So you could review them?
That's right.
All right. And in those records, you reviewed the records for the months preceding Mr. Jackson's death?
That's right.
All right. And in Dr. Murray's interview with the police, he mentions on multiple occasions that he was personally fully aware of Dr. Klein, and he knew at least 3 weeks prior to Michael's death he was aware that Michael Jackson was seeing Dr. Klein, correct?
That is correct.
Now, the sleep article that Mr. Flanagan was referring to, that's from 2010, and it was out of an experiment in China, correct?
That's right.
Okay, and I think you were very clear earlier specifying the differences, and that was an experiment in a hospital setting to see if in the future propofol could have any effect in treating a specific type of insomnia, refractory insomnia.
In a very highly monitored type of setting, using a very precise drip over a period of time like they did in the study, over 2 hours.
And again, even the authors of that study indicated it was simply an experiment and that future study would need to be done.
That's correct.
So what Dr. Murray was doing with Michael, with his treatment with propofol to treat insomnia, truly Michael Jackson was being subjected to an experiment by Dr. Murray.
Yes, without the appropriate precautions.
And there was no diagnostic workup, there was no lab work, there was no history, there was no pharmaceutical history. So from the records you reviewed, Dr. Murray had no idea not only if Michael Jackson truly had insomnia, but even what type of insomnia.
That's right.
I want to ask you a little bit about the doctor-patient relationship. That is a unique special relationship between a doctor and a patient, is it not?
That is correct.
Can you describe fundamental tenets of, that forms the basis of a doctor-patient relationship?
Well, I think the most important thing is putting your patient first. That is really, when we describe the Hippocratic Oath, the kind of the ethical, moral standards that doctors really have to abide by, is really putting your patient first and doing what's right for them. Knowing your limitations, knowing when something is beyond the scope of your practice, knowing that some things that patients may ask for may not be in their best interest, and knowing when to say no.
And knowing when to say no. In this case, specific to this case, if we assume is true that Michael Jackson requested that he be given propofol, and you as a qualified doctor knows that that is not only inappropriate but life-threatening, you have a professional, moral, and ethical obligation to say no, correct?
That's absolutely right.
No matter how much the patient may complain, no matter how much the patient may beg, you as the doctor have the obligation to say no.
That is absolutely right.
And who makes the final decision when deciding what is appropriate care, the patient or the doctor? Your Honor, could I ask Dr. White to please sit down? It's kind of distracting to...
If we would, please.
Thank you. Who makes the final decision as to the appropriate care, the patient or the doctor?
It's the doctor. I mean, again, your patient's welfare is first and foremost.
Now, Mr. Flanagan was asking you about the record keeping and Dr. Murray's ability to recall important facts or inability to recall important facts, and you reiterated that you need to have the record so that you can accurately ascertain the treatment and also accurately detect trends. In other words, maybe a trend in a decreasing or increasing blood pressure or an increasing or decreasing oxygen saturation, correct?
Correct. Particularly a decreasing oxygen saturation.
And in the defendant's interview, there's a perfect example, is there not, about his inability to give precise information as it relates to the oxygen saturation.
That is correct.
And on page 63, line 9, Dr. Murray indicates that prior to leaving his patient for what he said was 2 minutes, he indicates, quote, "I monitored, saw his oxygen saturation. It was in the high 90s, 90%. High 90s and 90% in the medical world are profoundly different numbers, are they not?
That's very, very correct. I mean, if you're starting off with an oxygen saturation of 99 or 100%, and then soon after your oxygen saturation is 90%, that is a very troubling trend. And that is, again, goes to why it's important to have these records. We're just not doing it to make life difficult for ourselves and for nursing staff. We do it for these reasons, so that we are able to follow trends and know when they're warning signs.
Okay, and from his statement here, it was in the high 90s, 90%. There's really no way to know which number he's referring to.
That's right.
And there are no records to look at to determine what the vitals were and to determine what that saturation level was.
That's correct.
Now, you were also asked by Mr. Flanagan in a hypothetical sense, could a doctor be grossly negligent and the patient survive? Do you remember that?
Right.
Okay. A doctor could be grossly negligent on a certain factor, and God willing, a patient could survive, correct?
That's right.
Okay. In this case, I want to talk about this case. Conrad Murray was grossly negligent in multiple instances, and that gross negligence directly caused the death of Michael Jackson, correct?
Absolutely did, yes.
Thank you, Doctor. Thank you, Your Honor. Nothing further.
Mr. Walgan? Thank you. Recross, do you need a moment, Mr. Flanagan? If you'd like, do you need a moment?
I'm okay.
All right, thank you. Recross by the defense.
You're aware that when Dr. Murray discovered Michael Jackson. He immediately performed CPR.
Objection per Conrad Murray's statement.
Is that the prefatory phrase?
I think that's all the information he has, Your Honor. I think
Why don't you re-ask the question, please? Sustained?